This is the story of the first South Asian woman to become a practicing doctor. She was a Bengali woman named Kadambini Ganguly, born in 1861 in Bihar and raised in Borishal, Bangladesh. She went to the Bethune School in Kolkata, which was a pioneering institution for girls at the time. In 1878, she became the first woman to ever pass the entrance exam for the University of Kolkata, and in 1882, she became one of India's first ever female university graduates alongside Chandramukhi Basu. In 1884, she became the first woman to ever gain admission into the University of Kolkata's medical college, then known as the Bengal Medical College. Despite being shunned and facing many challenges due to her gender, including a professor failing one of her papers because he refused to pass a female, she graduated with a GMC.B degree. This meant that in 1886, alongside Anandi Gopal Joshi, who was an Indian woman who graduated med school in the US, Kadambini Ganguly would become one of the first two South Asian women to ever graduate from med school. The reason Kadambini became the only one of the pair to become a practicing doctor was because Anandi Gopal Joshi unfortunately fell into illness in 1887 and passed away. Kadambini would go on to earn 3 additional medical degrees in the United Kingdom before coming back to Kolkata to practice medicine. Specifically, she practiced pediatrics and gynecology, wanting to make a more comfortable experience for women in South Asia who were previously only limited to male doctors. She raised 8 children and once went back to work only 13 days after giving birth. She and her husband were heavily involved with the Indian National Congress, and she was also one of the first women delegates. She advocated for women's suffrage, education, and emancipation. She also did advocacy for widow remarriage and challenged the caste system. None of this happened without severe backlash. The most notable example comes from an article published in the Bongobashi magazine in 1891. The article made many misogynistic and defamatory claims about Kadambini's character. Cementing her legacy as someone who always stood up for herself, she sued for defamation and won, which led to the author being imprisoned. Look, if you're a brown woman in STEM, any woman in STEM, or any woman at all, I can't think of many better role models that don't get spoken about enough. If you didn't know Dr. Kadambini Ganguly's story, please share and follow for more.